I'm hoping that it's recording. Yeah, it started. So, welcome to Emma and Emma from the Migraine Trust, running this online session for our unpaid carers. So, welcome and over to you. Thank you.
Emma, thank you so much for having us. And to everyone present today, thank you so much for being with us. We're really excited to be here to spend some time with you this morning, chatting through all aspects of life with migraine and how it can impact on different things. I'm shortly going to do an introduction to the Migraine Trust, but I first wanted to introduce myself. So we are Emma Heavy in the session this morning, three Emmas here. So my name's Emma Mitchell, and I'm here with my colleague Emma Curran, and we'll be running through the information together so that you don't have to listen to my annoying North Coast twang for the whole session. Before we start, I just want to quickly mention confidentiality. So anything that is shared within the session is confidential unless there's a safeguarding issue, and that might have to be raised because of duty of care. We've got cameras off due to the recording, and then you're very welcome to pop them back on during the informal session later. And if you do need to leave the session at any point for any reason, that's absolutely fine. Please just pop a message either in the comment box that Emma mentioned earlier or through to one of the Emmas as a direct message, just to let us know that you're okay. And then you're obviously welcome to rejoin when you're ready to do so. Okay. So what is the Migraine Trust? Who are we and what do we do? Sorry, bear with me. The Migraine Trust was founded in 1965 to improve the lives of people living with migraine. So we have been around for a while. We are really passionate about raising awareness and providing information and support to anybody that needs it. So that includes people living with migraine, their carers, family members, supporters, and anyone else surrounding them. We campaign for and empower people affected by migraine. So we can provide information and support in relation to all aspects of coping with migraine, and that can be at home, in the workplace, and anything else that comes up for them. And I'm sure you're all more than aware that it can be very different for different people. So we do try to tailor our support to meet the needs of each individual person. And we also fund and promote new research as well. Both Emma and I are privileged to work on the information and support services team. So if you do contact the helpline services at any point, you may well come through to one of us. And on the helpline, we offer a free confidential service offering tailored support and evidence-based information to anybody affected by migraine. We have a range of services available to try and be as inclusive as possible. We have our telephone service, our live chat, email, and online form. And our opening hours are currently 10 till 4, Monday to Friday. But we're mindful that people may want to reach out outside that time, so we can always you can always leave a voicemail, send through an email, or on the live chat, there's the option to send through a message that we will reply to when we can. We cover topics such as latest treatments, non-drug treatments, and complex migraine. We also have events. So the Managing Your Migraine events run through Eventbrite approximately every 6 to 8 weeks. And they're recorded and available to watch back on our YouTube channel. We're just very mindful that not everyone can attend at specific times and dates. So a bit like this recording today, they'll be recorded so that you can access them whenever is best for you. Okay. We also have a range of information that you can access on our website. So online we have over 50 different information pages, all about migraine, living with migraine, treatment options, and there's a whole section on there on how to support loved ones, family, friends, and a children specific option as well in terms of supporting others with migraine as well. We also have downloadable fact sheets on migraine care. We have an information manager who's been doing a great job of updating everything this year. So there's lots of new content and updated content available on there. and part of that work has been our toolkits. So we've got a number of toolkits for key areas designed to help people understand their rights and support them in making informed decisions. So the workplace toolkits, for example, has been newly published this year. And we've got different versions of that running. So we do have one for employees and then one for managers and employers as well. And these toolkits both look at the information on legal rights, practical tips for managing migraine at work. And then we've got additional resources to complement those. So we've got a new fact sheet on migraine in the workplace that can be downloaded or emailed to you and shared with managers and colleagues, and a checklist to guide any discussions between employees and managers around migraine and what you might need to support you. And then we also offer guides for support in school, for children and young people, and then for further education as well. And the third one relates to benefits that might be available to people living with migraine. So I'm going to pass over now to Emma C, and she's going to talk through the very important topic of what migraine is.
Thanks, Emma. So often people think of migraine as just a headache, but it's actually a complex neurological disease, and estimates suggest that around 1 in 7 people have migraine. So that's around 15% of the global population, over 10 million people in the UK, and that's comparable to the number of people living with diabetes, asthma, epilepsy combined. It is 2 to 3 times more common in women compared to men. Migraine can change over a person's lifetime, so attacks could become more frequent, they could change in symptoms and patterns. Some people notice an increase in frequency and severity when they enter perimenopause, and then that can settle down again after menopause. And we'll speak more on this later too. Migraine can be episodic or it can be chronic, which is defined as having 15 or more headache days a month, with at least 8 of those days having migraine features. We don't know exactly why people get migraine, but we do know that for most people there is a genetic link. It can often run in families. Living with migraine can severely impact a person's mental health, their relationships, and work life. There are lots of different types of migraine. We won't be able to cover them all in the presentation today, but thankfully there is an increase now in different types of treatments, though still not enough. We're now going to have a look at the different stages of a migraine attack. Migraine attacks come in various shapes and sizes, and there can be variation between attacks, but generally they will have these 3 or 4 stages. But just keep in mind that the stages won't always be obvious, though. The first stage is the prodrome or premonitory stage. This is sometimes described as the warning stage, in which certain physical and mental changes occur. These can include feeling really tired, yawning a lot, craving particular foods. There can be changes in mood, feeling either a change high or low, so feeling really down or feeling irritable. It can include feeling thirsty, experiencing neck stiffness. People talk about passing more urine, needing to nip to the loo more frequently. And these feelings typically can last up to 24 hours. The next stage for some people is the aura stage. Around a third of people with migraine have aura, and aura describes a set of neurological symptoms, and these can include changes in sight or visual disturbances, such as dark spots or coloured spots. It could be sparkles or stars, sometimes zigzag lines, a whole variation. It can include numbness or pins and needles. It could be weakness, dizziness or vertigo, so sensations of spinning and poor balance. It could also include speech and hearing changes. Some people experience memory changes too, and feelings of fear and confusion. And although this is more rare, it could also include partial paralysis. What aura is the result of a wave of nerve activity that spreads over the brain, and this is known as cortical spreading depression. And as this electrical wave kind of travels, the nerves fire in an abnormal way, and it creates this range of neurological symptoms known as aura that develop, but they are completely reversible, they are temporary. This stage lasts between 5 minutes to an hour, and it usually happens just before the headache stage. But for some people, they may experience those aura symptoms throughout an attack, or even after a headache has begun. It's possible to have the aura symptoms without the headache, and that's often referred to as a silent migraine. Next, we have the main attack stage, where for most that will include severe head pain that occurs. The headache is a kind of pain that's typically throbbing, and it tends to be made worse by movement. It is usually up one side of the head, especially at the start of an attack. However, someone might get pain on both sides or all over the head. Nausea and vomiting can happen at this stage, and you may feel sensitive to light, sound, smell, and movement. Painkillers tend to work best when they're taken early in this stage, and this stage can last generally from 4 hours up to 3 days. Most attacks will slowly fade away, but some will stop suddenly after the person with migraine maybe has been sick or cries a lot. Sleep does seem to help many people. Even just an hour or two can be enough to end an attack, especially so for children. Sometimes just a few minutes is enough to help. The post-drome stage is the final stage of an attack, and it can take hours or even days for that drained, fatigued, hungover type of feeling to disappear. Symptoms at this stage can be similar to those of the first stage, so the premonitory stage, or they can be kind of mirror opposites. They might be if someone found that they were that they had lost their appetite in the premonitory stage, they might find that they're really hungry in the second stage, in the recovery stage. If they were really exhausted in the premonitory stage, they might find that in the recovery stage that they're full of energy. Being aware of the different stages of the migraine attack can be helpful. It can help to prepare for an attack, to get a diagnosis, and to decide when to take treatment. So, for example, painkillers, or when to start adapting activities. We asked people to describe in one word how migraine makes them feel, and here are their answers. We produced a word cloud with their answers that enlarges the most common responses. You can see the physical impact of migraine here in words like dizzy, sick, disabled, exhausted, but you can also see the emotional impact with words like broken, depressed, scared, even suicidal. Migraine can have a whole body and mind impact. And I think Emma, this one is over to you.
I will take over, Emma. Thank you so much. Yeah, so from the picture depicted there, it's clear how complex migraine is. So what I'm going to do next is break down a few things kind of associated with migraine, starting with migraine triggers. And complex is a word that you'll hear a lot from us today because even the triggers in themselves are complex. With migraine triggers, basically it's something that seems to either cause a migraine attack or make a migraine attack worse. People often identify many different things as being migraine triggers. Some of the most commonly reported ones will include things like hormones, stress, changes in sleep patterns, and that can include too little sleep, which is probably a more obvious one, but it can also include too much sleep or even interrupted sleep. So people may be getting technically enough sleep, but if it's very broken, that can impact on migraine as well. Irregular eating patterns or skipping meals is another one. So often we kind of focus on the next one, which is dehydration, but not realize that maybe not getting enough nourishment or eating kind of enough or frequently enough can also become a trigger. Some people are very sensitive to changes in routine, changes in weather can also have an effect. And then for some people, things like caffeine or alcohol can be a trigger. Um, some of the other ones that we're hearing about commonly is exposure to bright lights or flickering lights, noise or strong smells. So there's definitely a sensory element in terms of migraine triggers as well. Um, as mentioned, the idea of triggers is really complex with migraine, and although it sounds straightforward for some of these things, identifying triggers can actually be really difficult. And part of that is because often it's a combination of several factors rather than just one thing alone. Um, and looking through the list, we can see that there are many things that can't be controlled. Hormones, for example, we've got little control over independently, things like the weather. But when we're taking care of other people and prioritizing their needs, there's also things that we can't control in terms of, being able to set our own routine as well. So that can elevate risk of migraine attacks occurring too. So, for example, if you've had a particularly stressful day, because you are more busy than usual or more stressed than usual, you might skip lunch to be able to continue to do the tasks that you need to complete. You might be up at night worrying about work or worrying about someone. And that combination of worry, stress, skipping meals, and disturbed sleep may combine together to trigger the migraine attack rather than one thing being the isolated factor. Um, so we know that one of the factors on its own might not have the full effect, whereas combining them can be difficult and it can be really hard to address all of them. And for many things, we can't remove it completely. So we look at how to kind of mitigate it and put protective factors in place. And then to make things even more difficult, sometimes what people think of as a trigger may actually be an early symptom of a migraine attack. A common example of this is if you're more sensitive to light in the early prodrome stage of an attack, so right at the very beginning, you might think that the bright lights are the trigger, but in fact, the response to the bright light is actually an indication that the migraine attack is starting. Some people will crave chocolate during that early stage, and it's quite common to crave specific foods or drinks as a attack is starting. But then after eating the food, chocolate, for example, you might associate that as a trigger, and it can be really hard, unfortunately, to tell the difference between them, which makes the concept of triggers even more difficult. Um, what can help, and we recognize that it's not always possible, is to try to keep a regular routine where you can. We know that migraine responds well to consistency, so trying to have some kind of factors that you're able to maintain depending on your schedule. And to try to be as mindful as you can within that about the things like staying hydrated, staying nourished, having kind of maybe handy snacks available that you can eat on the go. So people talk about things like nuts or things that are going to give good energy. And kind of taking that approach can take a little bit of the pressure off, because sometimes we can end up in a cycle where we're worrying about trying to identify the triggers, which can be really helpful. But if we're really focusing on that, then that can actually exacerbate the symptoms that we're feeling. So trying to kind of look at it holistically and put safeguards in place where we can help with that as well. One of the things that we talked about was hormones, and just wanted to touch on that briefly, because we know that hormones can have a big impact on migraine. Fluctuations in estrogen can be a migraine trigger, and that can mean that migraine is more common in women and people who menstruate than people who don't. Anything that affects level of estrogen in your body may impact on your migraine. It can also be common for migraine attacks to be linked to periods. As many as 2/3 of women with migraine will find that estrogen levels dropping in the lead up to your period can trigger migraine. And for many young people, they might experience their first migraine attack during their teens, which coincides with around the time that periods start, and that can be distressing. Um, Keeping a diary can help with that, and we use that with other triggers as well sometimes, to kind of show if there is a link between hormones and migraine. Pregnancy as well. Migraine often improves during pregnancy, especially during the second and third trimesters. This is because levels of estrogen slowly rise during the pregnancy. You don't have the changes that you would normally have. But again, as with all things migraine related, it's not the same for everybody. So some people will find that it doesn't change or that it may get worse. And then also connected with hormones is the menopause and HRT. So during perimenopause, the hormone changes are very rapid, which can trigger more migraine attacks. This does tend to settle down after menopause. Some people will find that migraine disappears once they get through perimenopause and are in menopause. But again, that kind of complexity and variations of normal, that doesn't happen for everyone. But we do know that HRT can be helpful for both the menopausal symptoms and migraine. Obviously, again, that's a very individual thing, but talking to your doctor about the best type to use can bring some relief. And then the last thing in this section is the contraceptive pill. So any contraception that contains estrogen can impact on migraine. The type of contraception you take and how you take it can make a difference. So if you take the combined pill, you may find it better to have fewer or shorter pill-free breaks, because that can help the hormone levels stabilize and avoid triggering migraine. And that can be particularly helpful for people with menstrual migraine where they're not experiencing attacks outside of the hormonal impact. Um, on that note, though, it's important to note that the combined oral contraceptive pill shouldn't be taken if you have migraine with aura. And in that instance, there's an increased risk of stroke. So it's usually okay to take if you've got migraine without aura, depending on other risk factors, and your GP would be able to talk that through in more detail. And I'm going to hand over to Emma, who's going to talk through some treatments.
Thank you. There are lots of different treatments for migraine, and what works really well for one person might not be the best for someone else. It can take a long time for someone to find the best treatment for them. Migraine treatments can be split into two types, so acute and preventive. Acute treatments are taken when an attack comes on to try and stop or reduce symptoms. These include over-the-counter painkillers, so your paracetamol, ibuprofen, etc., and also anti-sickness tablets, depending on what someone's symptoms are. And it can also include migraine-specific treatments known as triptans, and different triptans work better for different people. Rimegepant is a newer drug that some GPs may be able to prescribe as an acute treatment if they're unable to take triptans, or if the triptans aren't helping. Remember Rimegepant, because we're going to circle back to mention that one again later. Preventive treatments are considered if someone is having frequent attacks, if they're severely impacting on their quality of life, or if the acute meds just aren't helping. These are taken regularly to reduce the frequency and severity of migraine attacks. They include medications such as amitriptyline, propranolol, and topiramate. There are several others too. They typically take between 6 and 12 weeks to see an improvement, and people may need to try several different types to find the one that works for them. If you've tried at least 3 of the treatments that we mentioned in the previous slide, if you've tried 3 of those via a GP and they haven't helped, you may then be referred to a neurologist. This can differ by area and can take a long time. Those waiting lists sadly can be quite long. There are more treatments that a specialist can offer, and we have them listed here on the slide. So CGRP mAbs, that stands for calcitonin gene-related peptide monoclonal antibodies. And these were actually the first medicines specifically designed to prevent migraine attacks. The other preventers that we mentioned were medicines generally designed for other conditions, so depression, heart disease, epilepsy, for example, and they happen to be found to be useful too for migraine. CGRP mAbs target and block a specific chemical, that's a CGRP, that known to be associated with migraine attacks. Most CGRP mAbs are administered as injections just under the skin every month or every 3 months, and that's known as a subcutaneous injection. And it's similar to using an EpiPen or an insulin pen. People can do this themselves at home once they've been shown how to by a doctor or nurse. One of the treatments, Vyepti, is given intravenously into a vein by infusion, usually once every 3 months. But to have that administered, someone would need to go into hospital to have that given to them. GPANTs fall under the same class of medication as CGRPs, and they target that same CGRP chemical. The main difference is that they're given in tablet form. One type, rimegepant, the one that we mentioned earlier, can also be used for acute treatment. Botox injections are obviously famously known as a cosmetic treatment, but they're actually also approved for use on the NHS, and they can be very useful in the treatment of chronic migraine in adults. For migraine, those injections are given into specific areas of your head and neck and at doses that are known to be effective for migraine. It is really important to get this from a trained specialist in migraine. Most people also do need to have at least 2 treatment cycles before deciding if Botox is effective for them. A lot of people find non-drug treatments effective at managing their migraine. People may use these instead of or alongside of medicines for a whole variety of reasons. It could be that they're avoiding drug interactions if they're taking other medication. It could be that they're not taking medication due to other medical conditions or pregnancy, or if they find they can't tolerate medicines or just aren't finding them helpful. These can include acupuncture. So as well as a direct effect on the migraine attacks themselves, it might also be indirectly helpful because it can help people to relax and reduce stress. There are also migraine devices, and these are instruments or appliances that you wear or apply to your body, and they act on your nervous system to reduce pain signals. So examples include Cephally that you apply to your forehead, and that's similar to a TENS machine. There's also GammaCore, which is a handheld device that you apply to the sides of the neck. STMS is a device that you apply to the back of your head, and Nerivio is one that's worn on the upper arm. For supplements, evidence is fairly limited, but some people do find that they work. Those with the most evidence include riboflavin, magnesium, and coenzyme Q10. As with preventive medicines, it can take up to 3 months to see the full benefit of these. If you're going to start a supplement for migraine, speak to your GP first about this, and just make sure as well that you buy from a reputable source. There are self-help measures too, including things that people may do to relieve symptoms during an attack, such as heat or cold pack, gentle exercise, and lifestyle changes that may build resilience or reduce the chance of attacks. So we're often asked the question of whether migraine is a disability. This can have an impact on someone's legal rights, both in the workplace and elsewhere. The legal definition for disability is covered by the Equality Act 2010, which defines disability as having a physical or mental impairment that has a substantial and long-term negative effect on your ability to do normal daily activities. These activities could be anything from talking on the phone, going for a walk, driving, or working on a computer as another example. Migraine does count as a physical impairment because of symptoms like head pain and sickness. It is usually long term, tends to last at least 12 months. And that does still count if those symptoms kind of come and go over time, or if they're currently controlled by treatment. Whether it has a substantial negative effect depends on the severity of someone's symptoms and the impact that they have on that person's life. Someone may be able to provide a migraine diary or a letter from their GP or from their consultant as evidence that they meet the criteria for disability. Now that we've talked about what migraine is, the treatments and the impact that it has on the individual, we can now have a look at the ways that it impacts people at work and the ways that people can cope and manage in the workplace. This year, we carried out 2 surveys looking into migraine in the workplace. One, we asked 2,141 people with migraine, and the other, we asked 2,000 working age adults without migraine. The survey results showed a really troubling gap between the reality of living life with migraine and the perception of the condition from those who don't experience it. As you can see from some of the stats shown on the slide here, these are some really worrying results. Less than 2 in 5 people who don't have migraine would be very likely to believe someone who called in sick due to migraine. There are some other stats that aren't included on this slide. For example, that show that 58% of people with migraine had avoided disclosing their condition to employers or colleagues. And this is often due to fear of not being taken seriously. Only 19% said that they would be comfortable talking to their organization's HR about their migraine. 90% of those with migraine had kept working while experiencing migraine symptoms. Reason for this included fear of being faced with disciplinary action, feeling guilty about taking sick leave, and fear of losing their job entirely. This contrasts really sharply with responses from those without migraine that reveal a widespread lack of understanding about the condition in the workplace, with perceptions of laziness or of using migraine as an excuse to avoid work. All of this does impact on organizations as well as the individual employee. For example, 43 million workdays are lost to migraine each year. However, what we'll be discussing in the upcoming slides is that very often people with migraine need only small changes to their work or their workplaces to allow them to thrive. It's estimated that there's a 29 to 36% increase in productivity from migraine education programs. The service user had told us, "I'm considering leaving my job due to migraine, mostly as my employer hasn't supported me and the stress causes episodes every month." Here you can see a really vicious cycle, the lack of support at work causing stress, and then this stress actually triggering more migraine. Perhaps by just being supported, this stress would have decreased and the person might have had less attacks impacting their work. Antoinette kindly shared her story with us. She said, "I've had some really mixed experiences at work. I've had some really supportive colleagues and managers who would let me have breaks, make sure there were dark rooms I could go to, would cover for me, especially when loud noises were potential triggers." As you can see, she's had some positive experiences in the workplace, but sadly, she's also had some really terrible experiences. Antoinette told us that she's had managers who forced her to complete her work hours during a migraine attack, even though she was being sick and losing her vision. Her migraine persisted, and she had to call in sick the following day. Her manager was furious and told her that it wasn't good enough and that she needed to sort it out, suggesting that her migraines were her fault and something that she was doing, and even mentioned her weight. Of course, everyone can't be expected to know everything about migraine, but it's so common that there should be far more understanding about what it means, especially in the workplace. Even just talking to employees about what they need during an attack would take a lot of pressure off, and pressure and stress can be such a big trigger. It's just such a misunderstood condition, and people with migraine deserve better. So, how could someone manage migraine in the workplace? Helping someone manage that migraine can mean the difference between someone excelling at or potentially losing their job. Just a small amount of support and some really minor adaptations is often all that's needed to make a difference. It's the individual's choice whether to tell their manager or employer about their migraine. It can feel daunting, especially as there is often misunderstanding and stigma about the condition, but letting them know can mean that they're better able to provide support. They might also have certain legal obligations if someone's migraine is severe enough to be considered a disability. If you don't get migraine attacks very often, or they don't usually interfere with your work, it might still be worthwhile talking to your manager. Migraine symptoms often change over time, so it can be helpful for your manager to know that you have migraine. And it may still be useful to think about potential triggers in the workplace and how to reduce these. The points listed here on the slide are all about how communication in the workplace can potentially help. It's helpful to be clear on exactly what you need, and keeping a migraine diary can help you with this. We tend to encourage early communication with an employer or workplace on how you can be supported. It's important for this to be documented. You can go through our migraine workplace checklist with your employer, looking at areas together, such as how often you get attacks and the symptoms that you have, how long they last, and the impact on day-to-day life for you and the workplace. You can then discuss the support and adjustments that you need at work to help reduce or manage the migraine attack and the risks at work that can potentially increase your attack. Coming up with an action plan together and reviewing this often can be a way to effectively communicate care for your migraine. If it becomes necessary, you could also involve HR and occupational health, and this can be helpful in organising the support that you need and making sure that a fair process is followed. As we've said already, people with migraine often need very little help from their employer, and just some minor adaptations and a small amount of support can enable them to work effectively with migraine. These are known as reasonable adjustments, and some of the most common ones include access to drinking water, changes to desk setup or lighting, screen adaptations, and flexible breaks throughout the day. These adjustments will look different for everyone depending on their own triggers and the types of work that they do. With many people now working from home, it is important to keep these good practices at home as well as the office. So make sure that you have your home workspace suitable for you and that you have regular breaks throughout the day. It's so easy to sit and concentrate all day without any distractions at home, but that might not be the best thing for your migraine. Try to have catch-ups with colleagues to reduce any feelings of isolation, which may cause stress. And over to Emma.
Thanks, Emma. That's the majority of our presentation. We're kind of going into wind up mode now, and I really hope that it was helpful. We're always really interested in hearing people's experience of migraine. The most important voices to amplify are the people living with migraine and the people around them. And sharing your experience is an excellent way to help us raise awareness and show other people that they're not alone. If you are interested in sharing your story with us, we have a section on the website to do that. If you bring up our website and type in share my story, it'll bring up a form that you can fill in. And we do appreciate that contact. And then I suppose on the other side, just a quick reminder as well that our helpline services are available to all of you at any point as well. There are a few other ways to support the Migraine Trust. as a charity, we do rely on voluntary contributions to continue to provide and develop our range of services, research and support. And there's a few examples there on the slide in terms of ways of supporting. And what we'll do now, as Emma mentioned at the very beginning, is we can have a look at the questions in the chat and answer those whilst the recording is on. So if anybody does have anything that they haven't typed in yet, feel free to do that. And then we'll put the recording off and have a bit more of an informal discussion and answer any other queries that you might have. In terms of templates for keeping a diary, we do have, I'm just going to pop a link into the chat. We do have a template on our website that can be downloaded and used when keeping the diary. There's a few things that we would normally advise. So keeping track of the headache days or symptom days, but also giving a score, either kind of 0 to 10 or noting down whether it's mild, moderate or severe, so that you're also kind of keeping track of the severity of the attack as well as the number of migraine days or attacks, and then note down whether you've had any acute pain relief, and anything else that you find you might want to include to kind of identify triggers or anything else. In terms of holistic therapies, it's a bit of a minefield, and I know I keep coming back to the word complex, but it is a complex field because we have to be mindful when making recommendations about the evidence and the research. So there are a few things that have a bit more credible research, and acupuncture would be one of those. There's also some devices available. So we can't kind of advise on specific brand names, but we do advise that if you're looking at any kind of device, read the reviews, read a bit of background information on the company. And there's one that we do tend to mention, which is Cefali or Cefali. It's CEFALY, and they do have a little bit more research, and they also offer a policy of partial refund, and it's quite a proportion of the money that you get back if it's not effective. So that one is available online. And then the supplements that were mentioned as well. So there's 3 supplements that have a credible amount of research in terms of migraine relief. They're probably known to many of you, and they have multiple benefits, but for migraine relief, the doses might be a bit different. So they would be magnesium. It can be any form of magnesium, as long as the elemental dose is between 400 and 600 milligrams. So when you're looking at options, just make sure there's no fillers or anything, and it's the actual magnesium that's between that dose. We always just advise checking in with a GP or pharmacist as well, just to make sure there's nothing else that would contraindicate taking it, but it's safe for most people. The second one is riboflavin, which is also known as B2. And that one's also a 400 milligram dose. And then the third one is an antioxidant called coenzyme Q10. And for migraine relief, that's a smaller dose of 150 milligrams. With the supplements, again, a bit like the medications, we know that all of them work really well for some people living with migraine. Unfortunately, there isn't one that works for everyone yet, so it is a bit of trial and error. And a bit like the preventive medications, it's not a quick fix, so it is a cumulative impact. So it does take up to 12 weeks to be fully effective. Usually we'd hope that most people would see a benefit by around 6 to 8 weeks, but it does take that 12 weeks to reach full efficiency. So yeah, those are good options, but do if you or someone that you're caring for or supporting wants to try them, just check in with the pharmacist just to make sure there's nothing else that they're taking that would prohibit them. Emma, have I missed anything there?
No, that was really comprehensive. Thank you.
Any more questions before we turn the recording off? If not, that's absolutely fine. We're always keen to have informal discussions as well, so we can move on to that.
Thank you both for that really comprehensive guide. And I know there's a focus there on migraine and how to work with it in the workplace, but obviously, you know, there are transferable advices there for our carers, and they're cared for in their home environment as well. So we'll put the links in the write-up alongside the recording. And I just want to say thank you to both of you for your time. And we'll start the recording.
Thanks, Emma.